Good morning, doctor and friends. My name is Shannen Callista with student number 051, and we are from SGD B10. Would like to present our student project about the bereavement support as an excellent palliative care. So this is our team members, and here are the contents of our presentation today. Let's start from the introduction. For the background, at some point of life, everyone will experience the death of someone close to them. And grief is a natural emotional response to loss, although the course and effects of grieving differs from person to person. Next slide is the definition of the palliative care from WHO, which defines that palliative care is a total care of a patient with a life-limiting illness, which involves caring for the body, mind, spirit, and supporting the family throughout the process. It begins with diagnosis and continues regardless of the disease progression or treatment alternatives. And also, palliative care is a multidisciplinary approach which is used to focus on pain and symptom treatment as well as reducing discomfort of patients. Next slide is about the grief and bereavement support, which should be initiated as soon as a life-limiting diagnosis is made. Every effort should be made to assist the family to maximize the experiences they have with the patient during a limited time. Grief and bereavement support should begin before the death of the patient and continue for a period afterward. And it is also important for the palliative team to support family members to proceed with difficult news of the patient. Next slide. Therefore, palliative care includes the psychological, spiritual, and cultural aspect of care, as well as a support system to assist the caregiver and families in coping with a patient's illness and in bereavement. That's all from me. Next will be presented by my friend. Thank you.
Hello, my name is Putri Ayu Wulandari, number 11. So these are our research questions. What is the definition of bereavement support, of palliative care, the bereavement support for the patients and for the family, and what is the patient's candidacy for bereavement support? And these are our purposes of writing: to understand what bereavement support is, what palliative care is, to understand the bereavement support for the patients and for the family, and to enhance knowledge of patients' candidacy for bereavement support. And this is our benefits of writing. Public can acknowledge the importance of bereavement support as an excellent palliative care. Medical community can further understand about the definition of bereavement support and palliative care. Bereavement support for the patients and family, and patients' candidacy for bereavement support. And authors can enhance their knowledge about bereavement support as an excellent palliative care.
Hello, my name is Mani and the last three digits of my name is 249. Today I'll be talking about the definition of bereavement support. Bereavement is the experience of losing someone important to us, and it is characterized by grief, which is the process and the range of emotions we go through as we gradually adjust to the loss. Bereavement care means that the program that is support to hospice family and friends after the death of a loved one. Support is also available to the community members who have experienced a loss of a loved one. Even if they did not use the hospice service, support is definitely provided by the phone, by way of phone, mail, and contact, in person or counseling as well. Thank you. That's all from me.
Hello, my name is Gresya Hendrawan, student number 040. So let's talk about palliative care definition. So palliative care improves the quality of life of patient and their family who are facing challenges associated with life-threatening illness, whether physical, psychological, social, or spiritual. Adequate national policies, program, resources, and training on palliative care among health professionals are urgently needed in order to improve the access. The global need for palliative care will continue to grow as the result of aging of population and the rising of, burden of non-communicable disease and some communicable disease. Thank you.
Hello, number of friends. My name is Vindy from Valentine with student number 086. Bereavement support begin with preparation for dying and should be implemented early. It should be customized and personalized according to the patient. The preparation includes providing information to family and friends about what to expect and identifying the preferred place of dying, and then providing access to information about post-death factors that are consistent with a family's or friends' needs, such as funerals or memorial practice options. and the information needs to be clear, up-to-date, and reliable, written and verbal. Another support is helping patients to make memories in any form to provide healing and comfort for patient loved one in the years to come by creating or share something that will be a reminder of who patient were, what patient loved, and what was important to patient. Thank you.
Good morning, doctor and friends. My name is Putri Tamia Desriyanti with NIM 081. Bereavement support is provided at the time of patient death and funeral. When patient dies, convey condolence verbally and in writing. Prepare a death certificate and other documents needed for the funeral and provide private time for the family. Attend family gatherings after death to debrief and offer guidance to the family on normal bereavement process. Support from big family, closest friends, and support groups to forgive, support each other, and resocialize with those around them. About a week or 2 weeks after the funeral, follow up with the bereaved family to assess the family ability to cope with the loss and adapt to a new situation, namely life without deceased patient. Follow-up should be done with a home visit, but if it is not possible or there are obstacles, it can be done by telephone. Support that can be done to the patient family with personal counseling, so that the family is aware that someone knows and understands what they feel. Make peace with themselves so that the family regains a sense of security, self-esteem, and confidence to continue living. Assess and identify whether there are families who need professional medical assistance to help overcome the sadness and grief they feel, which can be done for 6 months after death by determining of appropriate bereavement care plan. After the family's condition has recovered, discussion can be held regarding the quality of care provided to the patient and family, the risk and prevention that can be taken against similar disease at the right time.
Hi everyone, my name is Sulung Utama Siringoringo with the lesson number 045. I'm going to tell you the goals of bereavement support for family, especially after the death. So the goals are: 1. To help the family to accept the fact that the patient has died and will not return. 2. To help the families adapt to new situations and condition after a loss. 3. To help the families to regain self-confidence and no regrets. And the last one is to help to change the environment so that it allows family to continue living. Well, that's all that I can tell you. The presentation will be continued by my friends. Thank you.
Hello, my name is Jonathan Edmund with the number 137. Right now I want to elaborate about the patient's candidacy for bereavement support. Bereavement support is given to patients that have already undergone palliative care to begin with. In this case, the related patient has an estimation of an untimely death, where the relevant members of the interdisciplinary team are already advised for the patient's death in a timely fashion. Assessment shall also be made as of the psychosocial condition of the patient and family on handling the situation they are in. Patients that are in hospital care and in home care are no different, as the interdisciplinary team can give bereavement support by having a house visit. The amount of primary caregiver should also be put into account to assess pre-death assessment and also post-death assessment for the patient and family bereavement support.
My name is Dharma Maha Putra with NIM 024. Conclusion: bereavement support is emotional, spiritual, and psychosocial support for patient and family before and after death to help patient and family to cope with grief, loss, and adjustment following the patient death. Palliative care is a community-centered integrated health service that focuses on relieving serious health-related suffering, be it physical, psychological, social, or spiritual. Bereavement support for patients should be implemented as soon as possible. Bereavement support for family help the family to recover from grief and return to the spirit of meaning in life.
Om Swastiastu, my name is Dalem Sukawati with the digit of student number 231, and I'm going to continue about the bereavement support for the family preparing for the death. So preparing and confirming the family regarding the preparation for the death of one of the family members helps reduce the risk of developing negative mental health outcomes. The resilience factors that make it easier for the family members to cope with an adjustment to loss through the grief process, including having a positive relationship with the entire family members, being able to use one's own strength and resilience to face the adversity, emotional support, understanding sadness is a normal thing and a helpful process, able to draw on past experiences of successfully dealing with loss or adversity to identifying coping mechanisms that work for them, taking good care of themselves, and have a hopeful outlook. Thank you.
My name is Pierre as well as Regis of student number 077. So, for preparing death and bereavement support for family, we do family gatherings where appropriate, provide the opportunity not only to share information and plan care, but also to understand and observe family functioning and relationship dynamic. And it also helps gather additional information that can inform the assessment of bereavement risks that the patient and family needs.
Hello everyone, my name is Putu Emilia Dewi with student number 028. So the palliative care should be started as early as possible in the patient's therapy along with life-prolonging support. The portion of palliative care with other therapeutic efforts must be balanced as shown on the diagram on the slide. When patients enter the end of life, therapy is focused on hospice benefits. Therefore, the patient and family can prepare for the patient's last moments and the bereavement period later.